Okay, so we're going to be looking ahead now, charting the path forward. So, Doc, I'm going to ask you, what key actions, using Imo State SACA as an example, should be prioritized to ensure equitable access and sustainable access to PrEP? And if fully injectable PrEP comes to stay, what should be the major thing the government should be looking at to make sure that everybody has access, regardless of whether you are in a rural community or whether you've heard of PrEP or not? What are the key actions you would recommend?
Okay, thank you very much. First of all, if the PrEP injectable is available, the work of the government is to accept it. When they accept it, they are now partners in progress. One, they need to sensitize the people. Now, because they own these service delivery points, they need to make sure that this, even if these injectables didn't move across the whole service delivery points in the state, they are the ones to map out areas or health centers that will act as catchment health centers where these products will be kept safe for people to access it. So it is the work of the government to give out these logistics. Now, because being partners and stakeholders, they will also help in the distribution because there is also logistics in this distribution. You have to transport these commodities to that hinterland. Don't expect those people that initiate this program to, have 100%, participation, bringing, procuring, and logistics in terms of distribution. So government has to come in to own it first, and also map out areas, with the already existing structure, so that people having been sensitized will now know the areas they needed to go and get these injectables.
Okay, thank you. So, if I just to round up, what is one policy shift that you think will make the biggest difference when it comes to PrEP access?
First and foremost, government need to provide policy and regulatory support for PrEP to thrive. You cannot just come out of a blue and start implementing PrEP. There must be a policy by the government supporting it, right from the federal government, right from NACA and the NASCAP to SACA and the SASCAP. So there should be policy on ground to support that. We've talked about engagement, community engagement. It is very, very important, that community engagement. We need to engage the communities, different communities. I've mentioned some of those communities: KPs, IPs, LACAs, CSOs, CBOs. We need to engage those people. There must be training, provider training and support. The people that will provide the services, they need to be trained so that they know exactly what they need to do. And they will also should also be concerned about the cost of the drug. Is it going to be free? If it is subsidized or made to be free, that would be fantastic. People will really accept it. There should also be programs geared towards stigma reduction. And so these are the key things we really need to do.
Okay.
Yeah.
Thank you so much. So just to round up, Doc, one word that the biggest challenge now that you think, I think if we solve this, probably to make a huge difference.
Well, the problem is acceptability, whereby the people accept this new innovation as a way of preventing the transmission of HIV because they are used to the pills. So one of the biggest challenges is for them to accept it, because without acceptability, there will not be adherence. You get it? So the people need to accept it. And that is where the government will come in to diffuse this challenge
Mm.
by making people accept that injectable is also a perfect way to prevent the transmission of HIV and AIDS.
Thank you so much, Dr. JohnPaul. Thank you, Chinedu, for participating in this podcast series. It's been an eye-opener hearing some things. And thank you so much for making our time to join us in this podcast series around SACAs, opportunities, gaps, and the path forward. Thank you. Bye.